Do you know what are the causes of gastric cancer? The definite causes of gastric cancer had not been found yet. However, many risk factors had been associated with gastric cancer. Then what are the factors? Risk factors of gastric cancers are first, hereditary and genetic factors. Hereditary gastric cancer is uncommon. However, genetic alteration in sporadic gastric cancer is more frequent. Studies had found that interleukin-1 beta gene and interleukin-1 receptor antagonist gene have been associated with increased risk of gastric cancer. Next is Helicobacter pylori infection. Helicobacter pylori is a gram-negative bacterium that colonizes the gastric mucosa in 50% of the human population. It is one of main risk factors of gastric cancer and had been declared as type 1 carcinogen. Other than that, Helicobacter pylori also has virulent factors, which are cytotoxin-associated gene A and regulating cytotoxin A, which are more likely to increase the gastric cancer risk. Cytotoxin-associated gene A will cause the inhibition of p53 function, which is one of the tumor suppressor genes, while regulating cytotoxin A will induce multiple structural and functional alterations in gastric epithelial cells. In addition, Helicobacter pylori also causes direct epigenetic effects on gastric epithelial cells and indirect inflammatory response on the gastric mucosa. Next is diet. Lack of vegetables and high red meat consumption increase the risk of gastric cancer. Red meat contains N-nitroso compounds which are mutagenic and carcinogenic. Lastly is high salted food. Salt can induce H. pylori infection and promote gastric cancer development. And the last is smoking and alcohol habits. Smoking increases risk by 60% for men and 20% for women. The combined effect will cause increased risk of gastric cancer by 5-fold.